Hi, welcome to the Fit and Healthy Today show. Today I have a subject that I'm going to be discussing that's near and dear to my heart, and probably about 95% of the population of the United States of America. And it is on anxiety. Different forms of anxiety, different degrees. Oftentimes, most anxiety is just very, very temporary. It goes and it comes. But when anxiety goes on for more than 6 months or reaches certain symptoms, it can be what we call acute. And it can manifest itself as in panic attacks. Most experts believe that they're principally caused by neurotransmitter issues in the brain or the inability of the liver to convert lactate in the blood into pyruvic acid. And women will have or tend to have more problems with that than men. So there is some potential biochemical explanations for stress. If someone has burnout adrenal glands as well, the excessive amount or continual amount of adrenal, or should I say adrenal exhaustion, the continued amount of adrenaline and cortisol will also keep stress, and they're the stress hormones, will keep stress high as well, physiologically. Chronic and generalized anxiety is a milder form of anxiety, doesn't show itself generally in panic attacks, and the symptoms aren't as intense. You know, they can go on for 6-month periods of time, but they're just not as intense as someone who experiences a chronic, everyday, and we'll review the symptoms type of anxiety. There's so many different degrees and different gray level degrees in between, and physiologically, emotionally caused, so many different factors that come into play that we'll discuss later on. It's very, very complex. And every individual is an individual when it comes to anxiety. So throwing a Xanax out to somebody when they say they've got anxiety without knowing or discussing any of these other factors is probably a pretty big mistake, because these have to be addressed first before you can make a proper determination on medications or on supplementation as well. Customer or patient has to do their research. Symptoms of anxiety. Probably most of us know most of these symptoms except for the severe ones. But restlessness, tension, you'll tremble, you'll get the little mild shakes when you're anxious. That happens to me. Heart palpitations, dry mouth, sweaty palms, diarrhea, mood swings. The list is pretty lengthy if you look on there, and we've got the good camera on there. We can kind of see muscle tension, spasms, you get backaches, hypertension. It can show itself in so many different ways. It's like, wow, and am I actually suffering from anxiety? Now, panic attacks are pretty clear. They are your heart pounds, rapid, difficult breathing. I mean, literally. And you'll even see these people that sometimes have to put the bags around their mouth in order to get the CO2, the carbon dioxide levels up. You feel dizzy, weak. It can last a few seconds or up to a few hours. And the thing about panic attacks is only about 70% of them actually over a period of time have been found to be treatable by standard medicine, standard pharmaceuticals. So, hence the further discussion. Okay, root causes. Now, it's kind of funny when you think about these. Obviously, stress, we know, can cause anxiety, but so can depression. So if people are going through divorces, a spouse dies, that type of thing, that depression can flip over back and forth into anxiety because the hormones and stress hormones and how we deal with depression can show itself in the shakes and all those wonderful other symptoms I just went over. Disturbed sleep can cause anxiety. You've got to have your sleep or you're like a drunken sailor. Or you'll get the shaky, you won't feel good, you can't react and respond. Certain hormones don't work well. Adrenaline, cortisol don't work well when you don't get adequate amounts of sleep. Caffeine, sugar, nicotine, alcohol, and drugs. So if you're there down in your 3 or 4 cups of coffee, puffing away on the cigarette, and you got 4 teaspoons of sugar in each cup, you got a problem. If you come home from work and you sit there and drink your 5 or 6 beers, and you've got anxiety, that can trigger it. Certain drugs and medications can trigger it. Even acid reflux drugs can contribute. You know, a lot of people we've had discussions about this before, but the acid reflux drugs can make for real severe anxiety. Food allergies and environmental toxins. There are certain toxins I know, even my own son, that when he eats them, he gets anxious. If he does red dye number 40 and has a red sucker, he's anxious and he's all over the place. So finding what we're allergic to and getting rid of those type of 3,000 chemicals that the U.S. government allows in our food is actually a very good idea as far as being able to eliminate an additional contributing cause to anxiety. Poor nutrition. If you don't give your body nutrients, it can't physiologically respond to stress. Our bodies are meant to be able to respond to stress and then de-escalate. If you don't have good nutrition and proper amounts of vitamins, you can't. If you have blood sugar issues and where your sugars are rising and falling and going all over the place, you can't deal with stress physiologically. You just can't. It just goes in absolute shutdown mode. Sugar is probably one of the biggest things that people ingest. Sugar and alcohol or white sugar, flour, pasta, all those things, all contribute to the inability to be able to properly react to stress. Adrenal and thyroid problems, a little bit of adrenal exhaustion, as I mentioned I had, where you're unable to regulate adrenaline and cortisol levels. Thyroid problems or even thyroid medications can contribute to anxiety. All factors that you have to review yourself and discuss with your healthcare professional. Mitral valve prolapse. Some of us, including myself, have a small mitral valve issue. That can contribute to anxiety as well, too. So you take all these factors in control here, and if you add them all up together, a good portion of our population has a combination of all of them. Hence, you're going to have anxiety. So, supplementation, and this is a little bit complicated in that, and we're going to talk about diet a little further on and some other techniques that you can use to help you deal with anxiety. But supplementation is broad. I've seen probably the best results with homeopathic medicines, one in particular called Rescue Remedy. But there's certain homeopathic remedies. Remember, homeopathy was the first approved American Medical Association treatment over, 150 years ago. So very safe, can be taken with other medications. You can look at various symptoms very specifically for what symptoms accompany your anxiety and use the proper homeopathic for that. Rescue Remedy is a pretty broad spectrum type of it's not really homeopathy, it's a Bach flower essence remedy, and it also has been proven and shown to reduce anxiety, and it's got 60 years worth of proof. When your average drug is only a couple of years, I think we got a good comparison to compare it to. There is a whey protein peptide in a product that I know as, and I left an R out of here, it's called tryptozan. In double-blind placebo studies, it was found to be more effective than Xanax. And guess what? No side effects. Isn't that cool? No side effects. You take one a day, it costs about $1 a pill, and more effective than Xanax to reduce anxiety. Okay? A good multiple vitamin high in Bs. Remember how I said when you have poor nutrition, you can't physiologically deal with anxiety or stress or anxiety? You need to get that multi-high in Bs, because when that stress hits, those B vitamins help prevent vascular damage. They help your nervous system properly react and respond. So at the very bare minimum, if you've got anxiety, get a good multiple high in B vitamins. And I'm not talking about something off the grocery shelf counter. I'm talking about something good that you know absorbs. A good health food store is where you want to get it. Calcium, magnesium, particularly the citrate forms or citrate forms, which are vegetable sources. They relax you. They have a very calming effect on muscles. They relax muscles as well as on your nervous system. So if you're calcium, magnesium deficient, or if you're sitting there down in a lot of soda that depletes your calcium, magnesium, or you're doing diuretic types of things, good luck with relaxing any of your muscles and not having anxiety. So this is very, very important. The dosage depends. Normally, most I see on the research is between 1,200 and 1,500 milligrams of calcium and between 400 to 800 milligrams of magnesium. Just depends on your body size. Food grade iron, and I'm not talking about ferrous sulfate that you get prescription or off the shelf at your local drugstore. We want something that actually the body can recognize as iron. Not old railroad tie or old iron, what they use metal types of filings that they chemically alter with sulfuric acid to get ferrous sulfate. I'm not talking about that. I'm talking about things that come from food. Iron. that comes from food. And most of our food nowadays is pretty deficient in iron, so there are supplements out there. There's a couple of companies that make them, whole food sources of iron. If you are deficient in iron, you will be anxious, okay? So, especially for those women out there that tend to flow heavy, run low iron, you get the dark circles under your eyes, you get dizzy, get your iron levels checked, because that definitely can contribute to you being tired all the time, which contributes to anxiety, but also your inability physiologically to deal with stress. Mineral ascorbate ester C, and this one is kind of a surprise because most people don't think in terms of vitamin C as being a natural, I can say the word, tranquilizer. A natural tranquilizer. Now, I'm not talking about ascorbic acid, because if you do that high a dosage, 5 to 10,000 milligrams of C, your urine, you're going to burn, and you're going to pull calcium out of your bones if you do the ascorbic acid form that you get at your local drugstore. So you need to look for mineral ascorbate or ester C forms. And I think probably the best description I found is it's needed for brain and adrenal glands, and for them to function properly. Also, those high levels of C also enable the liver. Remember that enzyme I told you that kind of helps you deal with lactate? It also helps with the being able to form and utilize that enzyme in the liver as well. So, natural tranquilizer, actually also very good for allergies this season too, because it's a natural antihistamine. DL-phenylalanine. 600 to 1400 milligrams per day. It increases endorphins. This is a synthetic form of an amino acid known as L-phenylalanine. I'm going to say the word right. I just say DLPA. When you increase endorphins, endorphins are your feel-good hormones. Feel-good hormones, anti-anxiety. There you go. Now you got to take it on an empty stomach, and there's certain types of medications that you can't take with it. So once again, you need to look that up, or your healthcare provider. And most medical doctors don't know about that. So when you go into a store, it usually says it on the bottle what types of medications you can't take it with. There's certain Mayo inhibitors and other drugs you don't do DL-phenylalanine with. But we've also used this under the supervision of doctors to help taper people off of pain medication as well too, because it naturally raises endorphin levels. L-glutamine, L-tyrosine, those are both amino acids. They also have a mild tranquilizing effect, and L-glutamine also helps with sugar cravings too. And tyrosine helps with some of the fatigue that goes along with all the anxiety. Very safe, very effective. L-tyrosine though, if you've had skin cancer, can't do L-tyrosine. There's just something to do with malignancy in that regard. Very helpful though as far as keeping things mild, especially if you have adrenal issues. The L-tyrosine helps with the fatigue that accompanies the stress and anxiety with adrenal, compromised adrenal. L-theanine, and this works with kids and adults, kids as well as adults. And what theanine does is it changes the brainwave pattern from a very high stress beta wave pattern to a very calm alpha wave pattern. We see it a lot utilized on ADHD kids who tend to have a little higher anxiety, but it works. I know for me, I'll take it if my mind just won't shut down when I'm in bed and I'm thinking about everything with the stores and the family and all. I'll take 1 to 200 milligrams of L-theanine. It quiets my mind. It brings me into an alpha state in the brainwaves. Very safe, very, very effective. Inositol, there was a very good study that was conducted with inositol. 12 to 18 grams in divided dosages reduced panic attacks from 10 a week to about 3.5 a week. Boy, if you've experienced a panic attack before, and I have, it feels like you're having a heart attack. And so if you can reduce those with an inositol type of powder, very helpful, easy to take. You can mix it with a little bit of juice in divided dosages. Okay? That's something to keep in mind, and it's relatively inexpensive as well too. Phenylfeverfew helps relieve the gastrointestinal, emotional types of upsets. Flax oil, there was a study on phobias. Now see, phobias are a type of anxiety as well. 3/4 of the people that were given just 2 to 3 teaspoons of flax oil, cheap, inexpensive thing,